Welcome to the webinar, High Performance Teams, a Critical Need to Restore Joy. Hi, I'm Barbara Lewis, the Managing Editor of .com, which is an online communication skills learning management system for hospitals, medical schools, and residency, PA, and NP programs. Joining me today is an expert in this field and the author of .com's Module 38 on High Performance Teams, Maisel White. She has over 2 decades of experience in facilitating organizational, interprofessional team, and individual change across North America. She is passionate about improving the quality of healthcare and patient experience and committed to restoring joy in the workforce. Maisel has a doctorate in family therapy and systems change. Welcome, Maisel.
Thank you, Barbara. And
so before we begin, Maisel, let me just tell everyone to, if you have a question, that you can type your question in the chat box in the panel. And if we don't have time to answer the questions during the webinar, we'll answer them afterwards. And a recording of this webinar and the PowerPoint will be posted on the .com website very shortly. So Maisel, I know we have a lot to cover today. Let's get started.
Thank you, Barbara. And thank you again all for joining us. Before I start, I do want to give a shout out to my co-authors, Carol Moscow, Marla Rowe, and Julie Clausen, as well as the team at BU for their original article on respect. So just to give you an overview of what I'm going to be talking about, I want to start with what's the problem, why are we even concerned about joy, do a short reflection, then talk about some solutions and what's in it for us as individuals and organizations. And then we'll take some questions again. So I like to think of what's the problem, what are the elephants in the room. And as far as I understand, there are really 3 that I want to talk about today. Healthcare is still unsafe for patients, it's unsafe for providers, and employee engagement is at an all-time scary low. So I'm sure you're all familiar with the original IOM studies that we harm about 500,000 people a year. What was interesting and frightening to me were the studies that came out in 13 and 16 that said when you think of about 500,000 people, that would be the equivalent of wiping out Miami, Florida, wiping out Oakland, California, and wiping out Atlanta, Georgia. That scares the heck out of me and certainly gets my attention. And then more recently, we've looked at what are the reasons for these sentinel events. And the Joint Commission has found that communication, human factors, and leadership are key issues. And so that's what I'm going to focus on today is team leadership and what the team leader's role is in bringing joy. But before I go there, I want to talk about the information about why healthcare is unsafe for providers. And lots of data shows that many healthcare providers suffer psychological harm. There's little respect, bullying, you see the articles, nurses eat their young, there's harassment, people are demeaned and ignored. And then what also surprised me is the amount of physical harm to employees, assault, and RNs having the highest rate of on-the-job injuries. A couple months ago, I was shadowing a hospitalist who was very anxious and nervous, and I asked, what's going on? And he described a situation 2 days previous where he had been called down to the emergency room and was assaulted by a patient who was demanding narcotics. His biggest concern was his wife said, you have a moral obligation to be and your 3 children to come home safe. And there's all-time burnout among healthcare professionals. That frightens me. And when you think of it, safety of our healthcare force is so tied to safety of patients. Unless we give them respect and protection that they need, we're not going to have safety. So that leads me to the third kind of problem or elephant in the room, which is this concept of employee engagement. Only about a third, or really less than a third, of U.S. workers are engaged and thriving. That means 70% are disengaged, with 18% of those actively sabotaging all the great things that we're doing. And of course, the cost is phenomenal. So, given that kind of bad news start, I want to change the tone a little bit and ask you to reflect. Think about a team that you've done your best work with. What inspired you to bring your best game to work? What kept you going when things got rough? And then if you'll type those comments in the chat box, we'll come back and think about how what your experience was ties with some of the research that I'm going to talk about. Let me give you a few minutes to do that, or just a minute. Okay, so let me come, for some reason my chat box isn't showing anything.
So actually it's in the question box. Can you see the question box, Maisel? The answers have come in with the question box.
Let me see.
So one is a common goal with wide participation, respect, independence and autonomy in our program, teamwork.
Cool. Okay.
I think of my family and the need to do a great job for their sakes, support, feeling I was making a difference.
Awesome. Okay. So hopefully I'll address all of those as we go on. So let me talk now about sort of the solutions that I've been able to cull from the literature that I think help us restore joy. And there are 4 that I want to talk about. Investment in the frontline leadership, attention to process as well as task, attention to stage of team development, and using the respect skills, which you can read lots more about in the .com chapter. So investment in the frontline staff. There is an enormous amount of worldwide research that the Gallup organization has done, and they found that about 70% of the variance of employee engagement is due to the team leader or manager, and that about 50% of employees quit to get away from their manager or team leader. And when I think of even myself, the very best job I ever had in my life that I loved doing, and it was a great fit, I left because the manager, not because of the job or the organization. And they also found that about 82% of the time, organizations fail to choose the right candidate. The candidates just don't have the right talent. And a good third of them are also disengaged. So imagine coming to work with somebody who doesn't want to be there. They're not very motivating, and if they don't have the right skills. So I want to introduce you, some of you have probably seen the Gallup 12. What's fascinating to me is that these 12 questions represent employees who are engaged. So they know what's expected of me at work, got all the materials and equipment I need, have the opportunity to be my best every day, get recognized and praised. Somebody cares about me as a person, and someone encourages my development. My opinion counts. And the mission is important, and my job is important. Coworkers are committed. I've got a best friend. Believe it or not, that's a critical factor. And somebody has recognized me and talked to me about my progress, as well as provided the opportunity for me to learn and grow. If we can get leaders to focus on these key 12 skills, we can restore joy to the workplace. These are the drivers. So let me move on to the second set of skills, which is attending to process. Healthcare is a very technical area where, we focus and typically hire people for their technical skills. But we also need to respond to the relationship skills. How do we welcome people to the team, even if it's a transient rapid response team? How do we recognize them, invite them in, communicate? How do we do check-ins to make sure people are fully present, doing huddles, doing briefings and debriefings, using IS-bar handoffs? And of course, my favorite is cussing, not the four-letter words that I always get in trouble for. But what Team Steps talks about is giving permission to say, I'm concerned about this. I'm uncomfortable. And if you don't get response, then raising the bar to say, this is unsafe. Let's stop. Those kinds of skills, if the leader can model and encourage, can bring all the difference to the team. Then what's probably new for many of you, and we really go into depth in this in the .com chapter, is attending to the stage of team development. And I know in healthcare, my experience shadowing hospitalists and working in various encounters is the team is in constant transformation. So really paying attention as a leader to these stages and that fine balance between task and relationship is critical. So the first stage of team development is formation. We need to affirm who people are and really make time to get their name. I remember once working with a surgical team and the surgeon slammed his fist on the table and said, I don't need to know anybody's stinking name. I just need them to do their job. Well, you do need to know their name. And in this stage, we're really focusing on inclusion, cohesion, what are the priorities, what are the different roles, so people know what's expected of them. If you're lucky enough to have the team go beyond that formation stage, then they can move into what's called differentiation. This is kind of when the honeymoon phase is over and people start to show differences of opinion. And healthy teams do better if they can express themselves. So you want to invite and acknowledge differences and demonstrate value for those differences. If a team stays together long enough, and sometimes this can even be in a shift, they can move into openness where people begin to affirm opinions and differences and can raise concerns. We know that when errors happen, there is almost always someone in the room or on the team that knew what was about to go wrong. They didn't have permission to say it. The fourth stage is what we call interconnection. This is where the team members' energy and creativity come to rise. They start problem solving. They really get into the team mission. And I can tell you, if the leader isn't paying attention to these stages of development, people get stuck and can't move to that sense of, I'm really part of this team. I like being here. This is critical. I've got something to offer. And then the last stage of team development is what we refer to as completion. This is celebrating the successes. It's appreciating the contributions of everyone. It's making the decision, can I stay together? What have I learned? This is so much where the debriefing becomes critical. Not that it's not important all throughout every stage, but really, what did we learn? So as a leader, it's, again, critical to have that fine balance between what's the task at hand, saving the life, and how can I build relationships and lay the groundwork so that people feel safe, comfortable, can express difference, and bring their strengths to work. So the next area that I want to talk about, which is sort of the fourth skill, is how do we utilize respectful communication? And this respectful mnemonic came from the original authors in Boston, and I would encourage you, when you get the slides, to look that article up. So it's a mnemonic. Those of you who don't know me or do know me know I love mnemonics. So respect stands for respect. Here we want to really affirm the value of every individual. We want to help them understand that we believe in them, whoever they are, from whatever country or religion or gender preference. We have respect, and I think in this day and age with all the controversy, that's even more important. The E in respect stands for explanatory model. Here we want to invite everybody to bring their perspective. From your view, with the glasses that you wear, with your education, with your ethnic background, how do you see this world? Because if we don't all share the picture of the world and the situation, we're not going to be looking at the same reality. This is kind of in Teen Steps, the shared mental model that you want to take into consideration. And then there's the concept of social context. Where does the individual, each individual on the team, come from? What are their stressors? What are their supports? What's keeping them from being fully present? You know, we all have our good days and we all have our bad days. Having a check-in at the beginning of the shift to see, hey, Maisel, hey, Barbara, what's happening? Oh, it's a great day. Oh, man, you wouldn't believe what happened. I went out the door this morning to the car. The dog ran out. Then he got hit. Then he puked all over the car. That's not a good start to the day. But it's important for the team to know what that context is at that moment. The P in respect is for power. How is power shared? And a good leader shares power, understands what the strengths are of each person, and flattens that hierarchy. Yeah, there are times when you have to take charge and say, darn it, this has to get done. But there are many times when we can say, hey, Barbara, you're really good at this. Hey, Frank, step up, help out. And let each other's strengths shine. That's going to be what allows them to have joy, being able to use their strengths at work every day. And the E in the respect stands for empathy. How do we listen to people's social context? Listen to their challenges and struggles, their explanatory model, and respond to that emotion with affirmation, or respond to that difference with affirmation. Thanks for being different. Thank you for having a different opinion and bringing yourself to the table. Validating individual members and supporting them. We can't live in this world without empathy. We're great at giving it to our patients. Well, some of us. It's an area I think we still need to work on. But we really need to also share that with our colleagues and employees. The C here is inviting people to talk about their concerns, express their opinions. Like I said earlier, for almost every error, someone in the room knew that it was about to happen, yet wasn't able to step up and say, hey, Maisel, you're about to make a mistake. And we really need, as leaders, to help people raise that. When they don't, they feel as guilty about the problem as those who committed it. The T in respect is for trust. This is really affirming that our outcomes are going to depend on whether or not we can have dialogue. And does that dialogue go both ways? Can I trust? And it also involves giving people the benefit of the doubt. I don't know about you all, but I find sometimes I'm rushing to judgment and climbing up that ladder of inference, making bad assumptions about people, and find the hardest thing for me is to get off that ladder and say, you know, I've got to trust what this person has to say because it's critical. So I've talked about the elephants in the room and why it's so critical for us to restore joy and focus on leaders and their skills and investing in them. Don't just promote them. I've talked about the fine balance between task and relationship. I've talked a little bit about the stages of development and using the respectful model. Well, what happens when we do fully engage our employees? Oh, let me just remind you that if you want to learn more about the respect model, you can look at Module 38 in .com. So here are the outcomes. When employees and doctors are really engaged, they're likely to recommend your practice. I'll never forget when I first moved down here to Florida, I met a group of leaders at a hospital, and one of the leaders said to me, Maisel, I can't wear my badge to the grocery store. I'm so embarrassed that I work at this hospital. And I thought, wow, that is a sad state of affairs when your leaders can't have pride in the place they work in. If they're engaged, they're likely to stay, so you don't have that turnover. They give the extra mile and are passionate. Think about our patient population laying in bed, frightened, uncomfortable, in pain, don't know what's coming next. Do you want the person that comes in and says, oh, I'm so sorry you had to ring the bell. I got busy. What can I do for you? Or do you want somebody that says, you rang again? What's up? What's with this? I personally want the first one that really cares about me. And when you think of the organization, when we've got engaged employees, they're much safer. They're happy, they're cautious, they take pride in what they do, they take care of themselves and each other, and because they're safer and they're happy to be there, they're a whole lot less likely to be absent. And they hang around and continue to do the job. They're also, interesting, the research at Gallup shows, much more productive. They will go the extra mile. for their patients and families and for their colleagues. Interestingly, too, there's less of this thing called shrinkage or theft. Oh, I'll just take that, because there's respect that what's there, the resources that are there, are limited and for specified purposes. Patient safety increases enormously. So does patient satisfaction. And almost all of the quality measures, the core measures for CMS and other unit measures, line up, significantly correlate with employee engagement. And then last of all, our financial performance is significantly impacted if all those other things line up, and we can continue to reinvest in the system and in the organization and in our employees. So I'm going to pause here and give people a chance to respond or ask questions. Whoops, let me back up on that. And Barbara, I still can't see the question box.
Right. So so far we don't have any questions about just about the slide deck, which will be posted on our website. But you can write any questions that you have in the chat box. But meanwhile, Maisel, let me thank you for all that great information. We really appreciate it. And of course, as Maisel mentioned, you can find out more about high performance teams in .com module 38. So let me just briefly talk about our next webinar on the next slide. We plan to host webinars each month, and you can sign up for our February webinar, which is going to be on mindfulness on the .com website, and you'll also get a invitation as well. Our March webinar will be about using .com for residency programs, and this is when .com is assigned after the match in March and before orientation, and a study that was done that showed that the scores were considerably better after using .com. So this webinar recording and the PowerPoint will be posted on our website, and you can view other webinars as well. On our next slide, let me just briefly talk about if you'd like to tour .com or learn more about Module 38, the high performance teams. Here is a code for you to use for a 30-day trial subscription. So Maisel mentioned empathy, and in our Module 6, we have an empathy understanding test where learners watch and listen to a patient and clinician interact, and then the learner clicks on where in the conversation an empathic comment should have been made. So let me just check our questions again. I don't see any questions. So thank you so much for attending this webinar, and I hope you sign up for our upcoming webinars as well. Thank you very much.
Thank you.